So there we
Okay, are you
go.
guys able
Thank
to
you.
see that?
Yes, I can say it. Thank you all for joining us. We appreciate your time. We have Jennifer Turner, one of our dietetic interns, that will be facilitating this virtual workshop in the know with conditions and nutrition. So we look forward to the information. And Jennifer, whenever you are ready, I see it's loading. There you
Yeah,
go.
it's fine.
There you go.
Okay. All right. So, good afternoon, everyone. Like Charlotte said, I am Jennifer Turner, Kaiser University dietetic intern, and thank you for allowing me to present today. Now, today's presentation in the Know with Conditions and Nutrition, we will discuss cardiovascular disease, GERD, this is gastroesophageal reflux disease, gout, obesity, and rheumatoid arthritis. I do want to mention that the main focus is on nutrition and how it can help improve conditions, and not so much on the medical side, but more of a nutritional therapy. Throughout the presentation, you will see a few slides with trivia nuggets. And while presenting on those particular the answer will be mentioned. So keep your ears open so that you can hear what the answer is to the trivia questions. And how the trivia works is you write down the answer, and at the end of the presentation, you email them. And for those who answer at least four of the five questions, will be entered into a raffle. Also, there's an activity that I would like for you guys to participate, where you will need to know your weight, your height in inches, and a calculator handy so that you can do the calculations. And when you're doing this, please do not answer into the chat box. This is just for you to know for your personal use and just to see where you stand at, okay? And we're going to start with cardiovascular disease, CVD. And what CVD is any disease of the heart, the vascular disease of the brain, or the disease of blood vessel. And see on the screen, we have the coronary, which is a heart attack, and the cerebrovascular accident, which is a stroke. And according to the World Health Organization, over 17.9 million people die every year from CVDs. And of these deaths, 80% are due to coronary heart disease, e.g., the heart attack, and the cerebrovascular disease, strokes. About 3 weeks after conception, the heart starts to beat and continues from that point on. Although your heart is the size of your fist, it's the strongest muscle in the body. It works continuously, no breaks. So just kind of think about how strong that has to be. And the summary of what CVD is: whenever the heart function becomes compromised, that is known as a cardiovascular disease, a broad term that covers any disorder that has to do with the heart. And your risk factors are, it's broken down in three different sections. We have your modifiable risk factors, meaning that these are factors that you can change. And that includes the physical inactivity, unhealthy diet, raised blood pressure, tobacco use, cholesterol, obesity, and being overweight. All of these factors put stress on your heart due to working harder to provide adequate blood flow. For your non-modifiable risk factors, it includes your family history. And that means there's no changing it. No matter what you do, there's just no changing it. And that's your family history and diabetes. There's no changing there's no changing your family and who you are. So if it runs in the family, it does not necessarily mean that you will be affected by it, but more of a likelihood, especially if you don't change your modifiable risk factors. So diabetes, want to just briefly talk on that. Once you have it, you have it. You can control and manage it well, and where your doctor may want to take you off the medications. But if you revert back to poor eating habits and being in physical and not being physical active enough, guess what? It's going to come back. So, and just keep that in mind. Even if you have diabetes and you get off of medication or you control it, just you got to stay with it. Don't just go back to the poor eating habits. And majority of deaths among diabetics due to CVD, it's associated with more of deaths with having diabetes. So just keep that in mind. And other common non-modifiable factors, it would be your age, your gender, ethnicity, and social economics. Getting old is a risk factor for CVD. And in fact, every decade after 55, the risk of stroke doubles. So yeah, that it's very common in that age group as you get older. Gender plays a role in the risk factors. Men are greater risk of heart disease than premenopausal women, and both genders, unfortunately, is the risk of are similar the risk of stroke. Being of an African American or Asian descent puts you at a higher risk other racial groups. And being poor anywhere in the globe, no matter where you are, increases your risk due to lack of means of being able to support yourself with a healthy diet. Went a little too fast. Sorry, let's skip one back. I wanted to go over the symptoms. There's a difference between heart attack and stroke. With a heart attack, you'll have like chest discomfort in other areas of your upper body, shortness of breath, and you can break out in cold sweat and have nausea and lightheadedness. And with stroke, it's more of a sudden symptom, like numbness or weakness of the face, confusion, trouble speaking. You may have trouble seeing out of one or both of your eyes. You may become dizzy, trouble walking, keeping up with your balance, and have severe headache with no known cause. Okay, it keeps going. I'm sorry, I keep skipping faster. Now, the medical nutrition therapy, the DASH diet. The DASH diet is a pretty good eating pattern to follow in general because you don't have to have heart issues. And the reason of the DASH diet being a good eating pattern to follow is because it focuses more on whole grains, healthy fats like your avocado or your olive oil, your seeds and nuts. It focuses on lean protein, more fruits and veggies. And adopting this eating pattern, it can help you get to a healthy weight and maintain that healthy weight. You also want to monitor your sodium intake to maybe 1,500 milligrams a day. And that includes your food, your drink, and your table salt intake. So you have to be mindful of that. And stop smoking, increase your physical activity, lower your blood cholesterol, lower your high blood pressure, manage diabetes, reduce stress, and limit alcohol. Reducing stress is very important because if you're always in an anxious or anxiety type of state, your heart has to work overtime to keep up. So that's putting a lot of stress on your heart. All right, and we're moving on to your GERD. And what GERD is, it's a condition in which acid-containing contents in your stomach persistently leaks back up into your esophagus. And the process of that, it starts with once you're eating your food and it makes its way down to its stomach. There's a valve there between your esophagus and your stomach, and what that does, it doesn't close properly. So if it's not closing properly where you're eating, some of the food reaches back up and causing a backwash and flows back up into your esophagus, into your throat, and causing a sour taste. And this is a very common condition. 20% of the U.S. population suffers from this condition. So that's a lot. So just keep that in mind. The risk factors are 40 or older, overweight or obese, smoking or regularly exposed to secondhand smoke, medications such as like your painkillers or sedatives, just to name a few, too much pressure on your abdomen, certain foods, dairy, spicy or fried foods, and hiatal hernia. And what that is the upper part of your stomach. It bulges into your diaphragm and causes food intake restriction. So a lot of it, comes back up. The symptoms you can have are, for most in common, for adults, are heartburn, regurgitation, feeling of food caught in your throat, coughing, chest pain, problems swallowing, vomiting, and sore throat and hoarseness. And children also, infants as well, can can also experience a GERD, and how the common symptoms for them would be the frequent small vomiting episodes, excessive crying after and not wanting to eat, other respiratory difficulties, frequent sour taste, hoarse throat, feeling of choking or waking up the child in their sleep, bad breath, and difficulty sleeping after eating. And for the medical nutrition therapy, MNT, you wanted to achieve and maintain a healthy weight. Eat smaller, frequent meals instead of big, large meals all at one time, where your food is not able to digest properly or go down in your esophagus properly. You want to stick to a smaller meal. Reduce the fat intake. Sit upright while you're eating. Avoid eating before bedtime, because when you eat and you lay straight down, the food doesn't is not properly going down into the system the way it should. When sleeping, you can raise the head of the bed 6 to 8 inches, so it can give you that upright position. Avoid avoid tight fitting clothing around the belly area, and stop smoking. And you can also speak with your healthcare provider, and they may prescribe some acid reducing medications. You want to cut out possible trigger foods like your spicy food, the fatty foods, the tomato sauces, the garlic, the onions, alcohol, coffee, carbonated drinks, and citrus fruits. Okay, there we go. And we're going to move on to gout. And what gout is, it's a type of arthritis. And arthritis is a very common condition, unfortunately. This causes swelling and pain in the joints. Gout is a chronic disease, and there's no cure, and probably will last someone's whole life. There's a sudden and sometimes severe attack when it comes to gout. And according to American Kidney Fund, kidney disease can cause and lead to gout, and gout may lead to kidney disease. I didn't know that when I was doing this research, but that's an interesting fact. And the symptoms, well, wait, I skipped again. Sorry about that. The risk factors, and there, as you can see, there's a long list of risk factors. I'm just going to read a few. For most likely for the risk factors would be if you're male and 30 between 30 and 50 years old, overweight, and have a high consumption of alcohol and high appearance diet. And what that is a chemical compound found in foods and drinks, and they are metabolized by your body and turned into uric acid, which is filtered by your kidneys. And too much of uric acid can build up and cause uric acid crystals and in one or more of your joints, which causes the gout. So you just got to be mindful of that. And that would be anything like, your asparagus. Something I know for a fact for asparagus, it's pretty high in purines. So you want to be mindful of that. And your organ transplant, exposed to lead, an Asian Pacific Islander or African American. And for a greater risk, if you have kidney disease, because if your kidney is already going through something, it's not able to filter out properly. High blood pressure plays a role in that. You can see your heart disease, some cancers, and some rare genetic disorders. Medicine also can play a factor in gout. Diuretics, beta blockers, and some niacin and levodopa that also has issues with, causing your gout. Let's see, go on to the next. I'm going to talk about the symptoms of gout. It's skipping a little too fast for me. I apologize. Your symptoms can be pain, swelling, redness, warmth, and stiffness. And although many people have their first attack in one of their big toes, an attack can happen in other joints as well. For example, you can it can attack like I'm sorry. Going a little too fast. Okay, There it is. Are you guys able to see the medical nutrition therapy?
Yes.
Yes.
Yes. Okay. All right. Thank you. All right. For the medical nutrition therapy, you want to eliminate your alcohol because consuming too much alcohol, your kidney's not able to filter out the uric acid. Instead, it's going to filter out the alcohol, and that can cause the buildup of the uric acid. And like I was mentioning before, you want to limit avoid the foods with high appearance like your anchovies, asparagus, and also animal organs is pretty high in that. So you want to try to, stay away from that as much as you possibly can. Of course, drink more water. That helps filter out the kidneys, and eat cherries and vitamin C rich foods like your oranges, strawberries, pineapples. Just to name a couple. And we're moving on to obesity. And what obesity is adults. And in adults, obesity is defined as having a BMI of 30.0 or more, according to the Centers for Disease Control and Prevention. The BMI chart, as you can see, I broke it down for you, is 18.5, you follow under the underweight, and 18.5 to 25 falls in the normal. The 25 to 30 is overweight, and 30 or higher is obese. And they break it down in 3 categories for the BMI. So 30 to 35 is class 1, 35 to 40 is class 2, and 40 or higher is class 3. And I just want to let you guys know that the BMI, which is the body mass index, it's just a guide. It's just a screening tool. It's not the end all be all or something that you just solely should focus on, because it doesn't take in consideration your age, your sex, your ethnicity, your muscle mass, and it doesn't distinguish between your excess fat, muscle, bone mass, or your distribution of how your body is with the body fat. So just keep that in mind. Don't just focus just solely on your BMI when you're trying to lose weight or go through your weight loss journey. Okay, and so now is the time for a quick activity. If you can get out your calculators and be able to do the calculation with me, and I can explain this for you. And remember, you don't have to post it in the chat. This is just for your personal knowledge. And so how you find your BMI is you take your weight in pounds, and then you divide it by your height in inches, times your height in inches. So that's height, your height in inches squared. And that number that you get, you want to multiply that by 703. So I'll give you guys some time to do that, and just let me know when you're ready, and that way you can see on the chart where you fall at. Are you guys ready?
Give another minute just to.
Sure. Okay, everyone have their BMI.
Getting some yeses.
Okay. Alrighty. So you guys figure out where you fall between the charts. And like I said before, this is just a screening tool. Do not just focus solely on your BMI. there's so much to more than just your BMI. So I just wanted you guys just to see where you stand at for that. Okay, and I'm going to go on to the risk factors. All right, the risk factors for obesity can be involved with your family inheritance and influences, your lifestyle choices. Again, we're seeing a common trend of poor diet and inactivity, certain diseases and medications, social and economic issues, and your age. And other factors can be your pregnancy. It's common for you to gain weight. You're supposed to gain weight through your pregnancy for the baby. Quitting smoking. Like when you smoke and you stop, you kind of pick up the habit of eating, just trying to keep yourself busy and not go back to your smoking habits. So that can factor into gaining the weight. Lack of sleep also has an issue with that. Stress, your microbiome, which is a bacteria, it's a gut bacteria. And if you're feeding or eating a very poor diet, and you're feeding the bacteria, junk food or just unhealthy food all the time, it throws it off and can cause you to gain weight and make it a lot harder for you to lose the weight. And the previous weight loss attempts, that's like your yo-yo dieting, where you're trying all type of fad diets. You lose the weight, then you gain it right back. You lose it, you gain it right back, and that confuses your metabolism, and it throws your whole body out of whack, and it causes you to gain weight and makes it a lot harder for you to lose the weight. And the complications with being obese is heart disease and strokes, your type 2 diabetes, certain cancers, digestive problems, gynecological and sexual problems, sleep apnea, osteoarthritis, and severe COVID-19 symptoms, as we've seen a lot lately in the news. So that has a complication with being obese. The MNT for obesity, of course, it would be the weight loss, getting down and losing weight, at least to get yourself down to a healthy weight for you. There's no one weight number for anyone. It's mostly about you getting to a healthier start for yourself, where you're healthy, where you feel healthy for yourself, and also your health reflects that you are at a healthy weight. Adopting a healthy diet, like I mentioned, the DASH diet, that's a great thing to go by. Exercise, be more active. Counseling to figure out why you have maybe a not so good relationship with food. Like if you're stressed out, you go and eat a whole bag of chips, or you just down a whole half a gallon of ice cream. Getting down to that root of why you have that type of relationship with food is a great thing to get it started, and knowing where it starts from and going on forward with the weight loss journey. Reaching out to support groups to know that you're not alone. There's someone else that's going through the same thing that you're going through, that can be very beneficial to you. And reaching out, you can help other people to know that they're not alone, and that can be beneficial to someone else. And here we are to our last condition, which is rheumatoid arthritis, RA. And what RA is an autoimmune and inflammatory disease. And that is when your immune system attacks your healthy cells, and that causes inflammation, and which is painful swelling, and that attacks your joints. And it's just to let you guys know that when you have RA, it attacks many joints at one time. It's very rare that it's only a certain one or two joints. It's very common for it to attack all the joints all at one time. The common joints that is affected by RA are your hands, your wrists, your knees. But RA can also affect the lungs, the heart, and eyes as well. And your risk factors goes as follow: your age, your sex, genetics, inherited traits, smoking, history of live births, early life exposures, and obesity. And the list of symptoms are pain or aching in more than one joint, the stiffness in more than one joint, tenderness and swelling in more than one joint, same symptoms on both sides of the body, the weight loss, fever, fatigue or tiredness, and weakness as well. For the MNT, you want to become more physically active as much as you possibly can. Join the physical activity programs. If you're afraid of becoming more physical because you don't want to hurt yourself, reach out to physical activity programs. There are some out there for RAs that can help you with exercise that's designed for someone with RA. So definitely reach out for that. You can join the self-management education, which teaches you teaches you RA and how to manage it and live with arthritis, rheumatoid arthritis. Quit smoking can help as well. Achieve and maintain a healthy weight. Again, common trend that healthy weight plays a big role in a lot of conditions that's going on. A lot of these conditions can be prevented if you eat healthy, a well balanced diet, and just be more active. And here are some resources. We have your on-site dietitian, Nicole Boone. You have your dietetic interns. You have the Lose and Win program. And also with United Healthcare, they have some programs, The Real Appeal in Raleigh. All of these are great tools to reach out for when you want to start your weight loss journey or while you're going through your weight loss journey. And if you want more information, please feel free to email staffwellness@palmbeachschools.org. And these are my references. And that's the end of the presentation. Are there any questions?
What I will just mention too, that those resources are not just for weight loss, but if you needed some one-on-one personal attention when it comes to any of the conditions mentioned today or any conditions that you are dealing with, you can schedule an appointment with Nicole, our dietitian at the doc, or you can schedule an appointment with one of our dietetic interns. So we do have the resources for you. This is just kind of a start on getting to help you think about what diet might look like if you are dealing with a condition. Of course, you can speak with your doctor, but if you wanted some specific dietetic information regarding any condition, you can reach out for help.
Exactly.
Yes.
I'm sorry, can I real quick add